Welcome back. We're diving deep today into clinical coder salaries here in the UK. We've gone through all the sources you sent, and look, our mission is pretty clear. Cut
Yeah.
through the noise, the salary figures out there, they're all over the place, honestly. So we want to find the actual best paying cities, but also where that money really stretches further for you. Yeah, because that clarity is just missing right now. If you say, look up London salaries, one job board might say one thing, another something wildly different. We're talking tens of thousands of pounds difference sometimes. It's kind of crazy. So forget those single misleading numbers. We need the actionable truth here. Right. Let's maybe start with the raw figures then before we just for anything else. Which cities seem to top the list purely on reported salary?
Okay, well, if we look outside the very specialized private roles for a moment, some regional hubs do look quite strong initially. Birmingham, for instance, has reports putting figures close to 49,000 pounds.
Nearly 49K. Wow.
Yeah, and Cardiff's averaging around 39,000 pounds, maybe a bit more. London, yes, it can have the highest ceiling, potentially over 56,000 pounds.
But I sense a but.
Definitely a but. That's strictly for, really senior people or very niche specialist roles, often in the private sector, not your everyday coder salary. And honestly, the bigger issue here is how shaky some of this data seems to be.
Shaky how?
Well, take London again. We found at least one source where the average salary was based on, wait for it, just 14 profiles.
14. Just 14 people.
14. That's hardly representative, right?
Yeah.
It completely skews the average.
What?
Plus, the job titles themselves are often lumped together. You've got senior specialists in the same pot as entry-level coders. It makes comparing things really difficult.
Okay, right. So the headline gross salary number is, well, almost useless on its own. Let's get real then. How does the cost of living factor change this whole picture? Because the UK is expensive.
Massively. And that's the crucial question, isn't it? What's the actual, real-world value? We know London's cost of living is, what, 50 to maybe even 68% higher than average nationally?
And housing's the big killer there, I assume?
Absolutely. Housing is the main driver. Think about it. An average one-bed flat in central London, you're looking at maybe £2,190 a month. Compare that to Cardiff, around £785 on average. It's nearly triple.
Right, triple the rent. So that 56K London salary suddenly doesn't look so shiny.
Exactly. It means someone earning, say, £41,000 in Birmingham might actually have more money left in their pocket at the end of the month, more disposable income than someone earning quite a bit more but living near London.
So where are the surprises then? Any cities pop up that offer good pay and reasonable living costs, the sort of hidden gems?
There's one really interesting outlier, Salisbury down in Wiltshire.
Salisbury, really? That's not usually on the high salary radar.
I know. But if the reported gross salary figure we saw around £61,000 is actually accurate for clinical coders there.
61,000 in Salisbury.
Yeah. If that holds up, it becomes an incredibly attractive place when you adjust for purchasing power. Because the cost of living, while not super cheap, is much more manageable than, say, London or the immediate surrounding areas. That income goes a lot further.
Okay, so purchasing power is king, not just the gross figure. We've established that. Location matters, but maybe not in the way people think. So if it's not just about the city, what really drives income potential for a coder?
Oh, now that's where you can take control. The single biggest factor consistently is professional development, getting accredited.
Like the ACC qualification.
Exactly. Achieving credentials like the accredited clinical coder status, the ACC, that demonstrates, a certain level of skill and standardization
Right.
that can boost your pay by over 40%. It's significant. And the career path is pretty clear, too. You start as a trainee, maybe around £24,000, £25,000.
Right.
So you progress, get experience, get accredited, and suddenly managerial or lead coder roles, they can easily push past £62,000.
So skills and experience trump location, especially when you factor in living costs. But what about remote work? Does that just completely rewrite the map?
It absolutely does. Remote work, fundamentally, it just decouples your earning potential from where you happen to live. Now, you have to take some figures with a pinch of salt.
Go on.
Well, one source reported an average remote clinical coder salary of £90,000.
90,000 pounds. Remote. Is that a regular employed role, or are we talking highly specialized contract work pulling up the average?
It's likely more weighted towards the latter.
Yeah.
Very specialized, high-demand contract stuff. But it shows you the potential. It shows the market will pay top dollar for the right skills, regardless of your postcode. That's the ultimate purchasing power advantage, right? Earning a high salary while living somewhere affordable.
Okay, so wrapping this up then. The big takeaway seems pretty clear. Don't just chase the highest number in the biggest city. It's about finding that sweet spot. Balancing a decent salary with a reasonable cost of living, like maybe Salisbury, surprisingly, and then focusing hard on your own skills and accreditation, like the ACC. That seems to be the smarter strategy.
Precisely. It's about the combination. And maybe one final thought for you to chew on.
Oh, go ahead.
When you're looking at jobs, especially comparing, say, an NHS role versus one in the private sector, don't just look at the base salary. Think about the whole package. The NHS often has, a much better pension scheme, more generous annual leave. Do those non-monetary benefits potentially outweigh a slightly higher private salary when you look at the total compensation? That's the deeper calculation you need to make. What's the real value to you?